Dignity Health Northridge Hospital Center for Assault Treatment Services, or CATS for short, was started because we wanted to bring victims of interpersonal violence out of the emergency room and put them into a trauma-informed area. We wanted to bring resources to the victims instead of having them have to go to multiple different agencies and locations to find the vital resources and services that they need.
CATS is the only sexual assault response team that provides services to the San Fernando Valley, Santa Clarita area. It is essentially co-located at the Family Justice Center here in Van Nuys, California. We conduct forensic interviews and evidentiary examinations for cases of interpersonal violence, such as child abuse, sexual assault, domestic violence, human trafficking, and other witnesses of crime.
As the program manager, I'm the liaison for our team of forensic nurses and our partners. I help facilitate not only the services that each of our partners provide, but I also help facilitate meetings and collaborations between our partners to make sure that we're meeting the needs of each of our patients.
As an outreach coordinator, I go out into the community and provide education regarding types of abuse, indicators of abuse, mandate reporting, as well as the services we provide here at CATS. When patients arrive at CATS, we follow a 3-step process. So they will come in, we'll conduct an interview, it will be audio and video recorded. This will limit the number of times that they need to repeat their story.
When a patient comes in to get forensically interviewed or examined, an advocate accompanies that patient with us. So if the patient chooses, they can have the advocate in the interview room and the examination, or one or the other.
So as soon as CATS gets a call that someone has reported that they have been victimized and is requiring immediate intervention, they will call us. Our advocate responds immediately so that they are here with the victim the entire time. That person is able to go with them into the medical exam, into the interview, and be with them for the entirety of their visit here.
The CATS model is different than other sexual assault response teams because we use forensic examiners and forensic interviewers that are nurses. So the forensic examiner is going to do not only the forensic examination, but also the forensic interview. So this is helpful because we find that people are more comfortable talking about healthcare with a nurse versus maybe law enforcement or even a social worker. The nurse is able to obtain more detailed information about the sexual assault that ultimately helps the full investigation and the team.
So having the forensic nurse examiner conduct the forensic interview allows the patient to feel safe, allows us to proceed with a more trauma-informed process. They feel more comfortable proceeding with the examination, which after they have experienced something like this can be quite difficult. And so building that trust and rapport will carry over into the exam room. They feel more comfortable having the same examiner go ahead and conduct the head-to-toe examination.
CATS works with many different partners such as law enforcement, DA, city attorney, social services, advocacy, and that's just to name a few. We meet monthly to determine that we're meeting the needs of all of our patients that are coming through the program.
Our investigative capacity here is all of the egregious offenses, what's labeled as the aggravated assaults, are destined to come here from our outside divisions. We'll assign them to a detective that's assigned here. And the idea of the partnership here is we can rely on our civilian contractors for assistance, expertise, or insight into our criminal investigations. If Dignity Health or Strength United has a question on LAPD protocol, they can just come down here and knock on the door. By being here, we're much more open, transparent, and readily available.
The layout of the CATS building is wonderful because it's very open. We don't have any closed waiting room areas. All of our walls are low and we let people sit and feel free inside of the waiting area. This is important because not all of the people that have come to CATS have always been free to move around, as they choose. We also have many different partners under one roof working out of this program. So that makes it possible for the partners to join us here and bring these services to the patients instead of those patients having to go out to multiple different areas.
We've got an outstanding facility here where we just recently completed construction of a mock courtroom where nurses, therapists, counselors, officers, detectives can receive training in providing courtroom testimony.
Really what's exciting about the work that we're able to do here is by virtue of being a one-stop shop. We are minimizing the amount of additional trauma and impact all these systems have on the victims who are going through this process. Additionally, we're able to share all of our knowledge and all of our expertise by being not only in the same physical space, but by partnering together.
I'm excited for the future of CATS because we're expanding. We're always looking for more partners to come in and provide those really vital services to our victims and to bring those resources to them. That's going to help us reach more people in our community that are suffering from interpersonal violence. The only way that we can do this, though, is to have the support of our community and our partners that are willing to help support us and to help us grow.